This presentation is about thyroid hormone and the effect it has on the skin by Shucayb Ciise, Mahmud Samantar, and Omar Omar. Thyroid gland is one of the largest endocrine glands, and the location of the thyroid gland is in the neck below the thyroid cartilage. The function of the thyroid gland is that the thyroid gland controls the level of protein production in the body. Thyroid hormone also regulates the growth and the rate of the function of many systems in the body.
What is thyroid hormone? Thyroid hormones are essential to proper development and differentiation of all cells of the human body. As you can see in the diagram illustrated, the hypothalamus and the pituitary in the brain control the normal secretion of thyroid hormones, which in turn control metabolism. As our topic is about the effect that thyroid hormones has on our skin, there are two conditions associated with thyroid hormones levels. These are hyperthyroidism and hypothyroidism. High level of thyroidism hormones can lead to a condition called hyperthyroidism. This basically increases the activities of the body organs, for example, heart rate, blood pressure, etc. This condition causes the skin to become moist and smooth. Furthermore, it can also lead to melanoma, which is bronze appearance to the skin, and even it can also cause melasma on the cheeks. Hypothyroidism is mostly common in women. According to my research, the ratio between females and males are 9:1. Some of the most common signs and symptoms known for this condition are as follows: being restless, nervous, emotional, irritable, sleeping poorly. For the females, most common conditions, signs and symptoms are losing weight despite an increase in appetite, also palpitation. Low level of thyroid hormones can lead to a condition known as hypothyroidism. This is when the body function systems is slowed down. Your skin can become very dehydrated. It can also cause thickening of the skin. For example, skin being rough and dry. The skin on the hands and feet can turn yellow. The hair on the eyebrows can fall out. Other hairs become coarse and brittle, and the nails break easily. Hypothyroidism can be inherited from families that has history of autoimmune disease. This diagram illustrates how thyroid hormones level is regulated. If low levels are detected, thyrotropin releasing hormone is released as a response. TRH stimulates the pituitary to release thyroid stimulating hormone. If thyroid hormones level increase, production of TSH decreases, which switches in turn slows the release of new hormone from the thyroid gland. According to my research, cold temperatures can also increase the level of TRH. This is thought to be an altruistic mechanism that helps keep us warm in cold weathers.
In hypothyroidism, the skin tends to be tough and covered with fine scales, which is noticeable on the extensor extremites. Histological examination that had been carried out revealed epidermal thinning and hyperkeratosis. Hyperkeratosis is when there's a high level of keratin. However, few studies has been carried out to explain the clinical findings. This is because most thyroidicosis results from Graves' disease. A study was carried out using surrogates for DNA expression. T3 stimulated the growth of epidermal keratinocytes and dermal fibroblasts. The study showed that the thyroid hormone resulted in the inhibition of keratinocytes growth when it were co-cultured with dermal fibroblasts. Therefore, in vivo, the growth of the skin that is directly stimulated by T3 may be an offset by inhibiting factors dependent on the systemic T3. The research suggests that systemically induced inhibiting factors may be bypassed with topically administered T3. Furthermore, a study into the vitreal keratinocyte have shown that reduced level of T3 has increased the level of transglutaminase, which is required in the formation of the cornblende envelope. This is the one that replaces the plasma membrane of differentiating keratinocytes and consists of keratin that are enclosed within an insoluble amalgam of proteins. In conclusion, the authors of this study have noted that beside the factors that affect thyroid hormone rate, such as hereditary and autoimmune factors, there was a direct effect of T3 applied topically rats had increased epidermal proliferation and dermal thickening. Combining these facts may lead to the modulation of thyroid hormone and receptors for skin renewal in the future. Thank you for listening.